Thank you so much. And hey, everyone, thank you for being here today over your lunch hour, or depending on where you are, might not be lunch quite yet, but I really do appreciate that you are here spending some time. And obviously, we're going to be talking about managing periodontal disease with effective home care. And we're also going to look a little bit at managing inflammation that is part of periodontal disease. So first, I want to thank Assisi Animal Health. They have been stalwarts really in providing continuing education for free for pet owners, for veterinary healthcare team members, and for all my colleagues in shelter medicine. And so welcome today to those of you in shelter medicine. And thank you, Assisi, for all that you do to support animals and the people that take care of them. So we are going to move on, and we're going to talk a little bit about periodontal disease. And what we have to remember, and what I'm sure you are seeing at the shelter, is that periodontal disease is the most prevalent disease in both dogs and cats. We also know that oral health is correlated with systemic health, and that pet owners and veterinary healthcare team members are recognizing that pets' oral health is extremely important. And so what I'm hoping that you're doing, and hoping that our veterinary hospitals are doing, is flipping that lip, right? Providing, performing an oral examination on every single pet that you see every time you see them. Because we really need to, get a handle on what is going on in that oral cavity, right? We see quite a few different views here. So again, let's, take a look in that mouth and do an oral examination. Now, we know that periodontal disease is the #1 health problem in small animal patients, but patients generally show minimal outward clinical signs. So oftentimes periodontal therapy isn't indicated until late in the disease course. So if periodontal disease is the #1 health problem in companion animals, then it may also be one of the most undertreated diseases in this group as well. We know that if we were to ask pet owners what are their top 3 concerns, either cat owners or dog owners, within those top 3, dental problems or oral health issues has always landed in the top 3. And so the prevalence of periodontal disease, well, the numbers are important to share with your potential adopters, to help them understand how critical both veterinary and home dental care are to the health of their pets. By 2 years of age, 80% of dogs and 70% of cats have some form of periodontal disease. Small and toy breeds, they are particularly susceptible, as are the brachycephalic or the smush-faced breeds. And so even after teeth are completely cleaned, plaque starts to form on the tooth surface within 24 hours. And lack of home care for 1 week can result in gingivitis in some patients, and lack of home care for 3 weeks in all patients. And so if we were talking about dental pockets, one study found that those dental pockets became reinfected within 2 weeks of a dental cleaning or periodontal therapy if home care wasn't performed. So oral health is a combination of professional therapy and effective substrate control. And so, professional therapy, obviously the veterinary healthcare team is going to do what we know as what I call periodontal therapy. But effective substrate control, we need to start recommending Homecare to keep the plaque and the bacteria down after a dental cleaning. We're going to talk a little bit about that. So periodontal disease affects the periodontium that surrounds and supports the tooth. And the periodontium consists of the gingiva, the periodontal ligament, cementum, and alveolar bone. And when we're talking about periodontal disease, it's commonly referred to as gingivitis and periodontitis. Gingivitis, as you see here, is, if it's itis, it's inflammation, right? So it's inflammation of the gingiva. And gingivitis is reversible and can be appropriately treated and really largely prevented with thorough plaque removal and effective supragingival plaque control. Periodontitis is more severe and for the most part is not reversible. And so it requires advanced therapy, meticulous plaque control to prevent progression of the disease. Gingivitis may progress to periodontitis, and although the course is unpredictable and heavily dependent on the individual animal, it is known that gingival inflammation is the first step in the development of more severe periodontitis. So here's an image. We can see gingivitis here, that red inflamed. This is very much an inflammatory process, right? We can see the plaque starting to build on this tooth. And now we're seeing calculus, right? Again, we're seeing gingivitis right here along where the tooth and the gum meet, right along here. You can see again, even though this may not be the best picture, the best image, you can see how red and inflamed those gums are. And we can see even more plaque that is now turning to calculus or tartar on these teeth. And when we talk about dental disease and flipping that lip, so often, and it's unfortunate because if you look at this, how painful is this, right, for our patients? But often when we flip that lip, this is what we see. Now, this is stage 4 periodontitis. There's 4 stages, which I'll touch on in just a second. But you can see, I mean, talk about red and inflamed bleeding, a little extra growth here. We also see pus, right? Nasty stuff. And so think about this in our pets and think about the mouth as a mirror for the rest of the body. So if we're seeing this in our patients, then definitely there's an impact on the systemic health of dogs and cats. There is most definitely a positive correlation between the severity of periodontal disease, which we just saw, and histologic changes in the myocardium, renal, and hepatic tissues. Culture of the same bacteria from periodontal pockets and heart valves. So there's proof showing that that bacteria is traveling to important organs. And bacteremias can be induced by periodontal procedures. And so what we see here is that traveling bacteria that I just spoke of, systemic inflammation, right? Far-reaching effects and pain. We just saw that stage 4. Would you consider that a painful condition? I think you're going to say yes, right? It's very inflamed. It's extremely painful. Now, most humans don't get to that point, right? And why? Because typically most, human beings are brushing their teeth twice a day, going to have dental cleanings every 6 months. We also, floss, etc. Dogs and cats were obviously that's not happening. So if we look at plaque, again, you can see plaque formation right here and gingivitis. Plaque is that soft, sticky film of bacteria glycoproteins, inflammatory cells, and debris. And it's a biofilm of intricate ecological community comprised of distinct families of bacteria. And it is most definitely the primary cause of periodontal disease. Calculus, or tartar, is that hard shell, which we see here, of mineralized plaque. It's a rough surface, right? So it enhances bacterial attachment. So not only is the bacteria attaching to the tooth, now it has an even better attachment to the tooth, or to the tartar on the tooth. And it acts as a local irritant, right? This buildup right here, that's very irritating to the gum. And tartar, again, is a rough surface that enhances bacterial attachment. That's what I mean by secondary role. So this here is a secondary role in the accumulation of tartar. I mentioned staging, and there are 4 stages, right? Again, gingivitis, stage 1, and then there's 3 to periodontitis. So early periodontitis, moderate, and like what we saw earlier, advanced periodontitis. And you can see here that, you know, the roots are exposed. That bone has been eaten away. The jawbone has been eaten away. And again, look at all the inflammation, even stage 1, gingivitis, because again, remember I said itis means what? Inflammation. So it's inflammation of the gingiva, and periodontitis, definitely, again, inflammation of the periodontium. And we see that dogs here, well, I guess it says cat, doesn't it? Dogs here and cats on the right. So if we are going to institute periodontal therapy, you know, this dog, even though those front teeth are looking not too bad, we see some plaque buildup here. We definitely see gingivitis. We see tartar here. And so to control this periodontal disease, a thorough professional examination is needed. And then appropriate periodontal care and therapy. And you may have heard the term COHAT. COHAT stands for Comprehensive Oral Health Assessment and Treatment. And so it's really a comprehensive treatment plan for the control of periodontal disease. It means an assessment of the whole mouth of that cat or dog, oral exam, dental x-rays, and treatment plan then is created for any problems found. So typically that's going to be, you know, a dental prophylaxis. And what I don't want us to forget, because it is extremely important, is part of that comprehensive assessment and treatment is application of effective home care. So with home care, right, there are so many different at-home oral hygiene products. What we're aiming at, what our goal for home care is daily plaque control to control gingivitis and periodontal disease. It's critical to overall successful periodontal therapy. So effective dental home care provides plaque and calculus control between professional treatments. So hopefully, and I know it's different in the shelter setting, but hopefully together we can educate owners that, you know, really, just as in humans, pet owners should be taking their pets in for an assessment twice a year. Some may need, you know, a dental prophylaxis or periodontal therapy twice a year. Some may not, maybe once a year, depending on the home care that we are educating our adopters and our clients about. So we want to educate them on procedures and products that owners are going to use on their pets, because again, it's a critical adjunct to professional intervention, and it's essential to sustain the success of professional periodontal therapy, but also to help mitigate disease. Because remember, that bacteria in that really gross mouth is going all through the body. There are thousands of products available without evidence to support that they actually work. It's confusing and misleading to many pet owners. Yeah, it's also kind of confusing for us, right? And what I want pet owners to remember is that you, as my shelter medicine colleagues and other veterinary healthcare teams, we should be the best resource for making appropriate therapeutic and home care recommendations. And again, now I want to kind of focus on how do we get through this confusion, right? We know, we've already said there's tons of pet oral hygiene products. Most of them are over the counter. You may get questions on, how do I know which one works and which one, maybe doesn't. The majority of them lack any evidence that they actually work. So one way to help educate pet owners, potential adopters on, cutting through this confusion is to look at evidence-based medicine and the Veterinary Oral Health Council seal of approval, because it helps cut through the noise, right? It demonstrates company commitment to science, and it elevates the professional recommendation made by you, made by general practice veterinary healthcare teams. And so when we're educating our pet owners, let's send them to VOHC.org, because this will list the approved products that have been shown to help control plaque and or tartar. So what's the gold standard? Toothbrushing, right? We know that. Study after study has shown that pets that have their teeth brushed, that's the gold standard. But how many of our owners are able to, brush their pet's teeth? How many of us are able to brush our pet's teeth? Not too many. If they can, if we start them early and they keep at it, perfect. That's wonderful. But, oftentimes it's not this easy, right? We wish it were. And this cat has probably been worked, their mouth has been manipulated from an early age. The same with that Australian Shepherd. Who's good for the most part with toothbrushing? Greyhounds. I have seen more greyhounds that will sit for toothbrushing than really any other breed. Maybe that's just anecdotal, but that's what I've seen. So, I'm going to talk about diet, right? I'm going to work it in somehow because diet affects every disease condition. And there are dietary effects to periodontal health. If you think about it, many pet owners think that, as long as it's a dry food, it's cleaning their teeth. That is not the case. Studies suggest that soft foods promote plaque accumulation, and that fibrous textures, so those fibers that are aligned, help to reduce plaque and calculus accumulation. The myth is, again, that dry, crunchy foods prevent plaque and calculus accumulation, and that's just not true. So if we look at a dry food versus a dental diet, a therapeutic dental diet, there's also some over-the-counter dental diets. So here we have a tooth, right? And we see the plaque and the biofilm in the yellow around that tooth. This is your regular old kibble. The tooth bites into that kibble, and the fibers are interlocking, right? Crisscross. So that kibble just crumbles. Whereas, again, the dental diet with texture control, again, goes like the fibers are aligned. So then that tooth bites into that kibble. The kibble doesn't break apart and helps to act like a squeegee to take that plaque off. So shown another way, this is simulating a tooth, and this has whiteout on it. And for those of you who are young, whiteout is something that we used to use when we wrote a lot on paper or typed with a typewriter. So yes, back in the day. But so here we go. This is simulating a tooth, and this is a dry, just your regular kibble. You can see here that the paint, think of it as paint, is still there. The kibble just broke apart, right? There's some crumbles here, definitely crumbles in there. Now the difference with a dental diet is, first, it's a little bit bigger, and that's going to allow for those fibers. And here we go, basically, again, simulating a tooth biting in, and you can see it didn't crumble apart or break apart. It right here and right here, it squeegeed that, for lack of a better way to describe it. It squeegeed that off of that screwdriver, which is simulating a tooth. So just trying to show you what I meant by that. And is there evidence to support this? Yeah, and that's what we want to use, right? We want to use the research that's out there to help educate our pet owners and potential adopters, right? So, you know, this is just talking about dietary cleansing of the tooth. And this is just saying that, you know, not promoting this, you know, any diet over another one, but just showing that some diets have evidence-based medicine behind them and have peer-reviewed publications that support the efficacy. Remember, there's hundreds to thousands of products out there, so we need some way to set them apart. So let's look at the research that's been done. So this is, you know, TD, which is a Hills product. They also have Oral Care, which is a Science Diet over-the-counter product that we can, you know, recommend, along with some other products. So this is the control diet and the therapeutic dental diet. After having a dental prophylaxis, you can see starting to build some plaque there, definite gingivitis. Whereas in this one, you see that those teeth are still nice and clean. And so after 25 weeks, we can see the control diet, right? There's a lot of plaque accumulation there. Again, the pictures are kind of blurry for you probably. Lots of inflammation. We're not seeing that after 25 weeks on the therapeutic dental diet. So what else is out there? Again, I'm going to encourage all of us to go to the Veterinary Oral Health Council website. But, you know, rawhide treats, they also have some evidence. They can control, certain ones can control calculus when they're fed 2 to 3 times a day. Now that makes me a little nervous, feeding 3 rawhides per day. But we also have to look at, you know, the amount of calories in those. But, you know, studies show that when feeding them 2 to 3 times a day, it does help to control calculus. But there's no evidence to support, because some of them add chemicals. And for these rawhide treats, if chemicals are added, it's not really supporting that part of it. Baked biscuits, like we see here in the middle, it's just like a kibble, right? There's no data to demonstrate significant benefit. And then the last one is, you know, chewing devices. And we all have these. I'm not saying they're no good. I'm saying that, there's no evidence of effectiveness. So, but we know our dogs like them, right? And if we look at the home care categories, there's mechanical plaque and tartar control. There's chemical plaque control. There are, so with chemical plaque control, there's antimicrobials, enzyme systems. Chemical tartar control has chelating agents, which bind to different things on the teeth and pulls those off. Oravet is another great product that helps to reduce plaque and tartar. And there's powders that can be added to food. There's also water additives. So again, don't listen to me. Make sure that our pet owners are going to ask us questions and go to the Veterinary Oral Health Council website. And so we know that oral health is a combination of professional therapy and home care, right? Effective substrate control. It's not a once-a-year procedure. It has to be incorporated into daily practice. And it's not a one product fits all. So why do I encourage you to go to the VOHC website? Because they are providing effective plaque control between professional interventions, which we already know is essential to oral health. The products are awarded the VOHC seal of acceptance. They've demonstrated efficacy supported by randomized, blinded, and controlled trials. So we have the research there. And company trials are reviewed and approved by an independent council of veterinary dental experts. The VOHC is recognized and endorsed globally. And when we're educating our pet owners, right, many of our products have the American Dental Association accepted seal of approval. Well, we have a similar seal of approval in veterinary medicine, and that's the Veterinary Oral Health Council seal of approval. Now, with all those pictures you showed and that I showed, and all the disease conditions that I mentioned, gingivitis, periodontitis, there is an inflammatory process. And so recently, Sissy Animal Health came out with a dental loop, and it delivers the same proven effective FDA cleared TPEMF signal as the Sissy loop, the one that we know and love, and it's specially designed for use on dental and oral surgery patients. It helps to reduce oral and dental pain and inflammation. We saw those mouths, right? We know that those are painful. We saw that they're extremely inflamed. They also help to reduce pain and swelling after dental procedures, after oral facial surgery and trauma. And they help to reduce the need for opioids and other pain meds. Also aids in preparing those tissues for surgery and for an upcoming periodontal therapy. And so we want to help, we want to use the Sissy Dental Loop to help improve and increase recovery and decrease pain after periodontal therapy and extractions. We want to use it to decrease healing time and pain after surgery, to decrease inflammation caused by stomatitis, periodontitis, gingivitis, and to decrease swelling and improve tissue condition prior, again, to oral surgery. So we know that the targeted pulsed electromagnetic field signal delivers a microcurrent to damaged tissue. How? We saw the tissue damage in all those different pictures of the oral cavity. It's precisely tuned to trigger the animal's natural anti-inflammatory process. That electromagnetic signal helps stimulate cellular repair. The biological effect of induced current, leads to, it's a functional therapeutic component. And the targeted pulse electromagnetic field enhances nitric oxide which has several biotherapeutic effects. Assisi has peer-reviewed information on the targeted pulse electromagnetic field therapy. And that peer-reviewed research shows that it enhances, again, that nitric oxide production, which is a key. It's crucial to the healing process. So I want to remind everyone that pets need dental care too. Remember, it's in the top 3 concerns for our pet owners. And we need to start having these conversations, start flipping that lip and seeing what's happening in that oral cavity. So hopefully